Hi, welcome to the show. I'm so excited to have you today.
Thank you so much for having me on.
I am going to be very honest. I am completely brand new in understanding really anything about your specific focus within being a certified athletic trainer. Your direct mode of, I guess, your modality is postural restoration.
Yeah.
And I came across you on Instagram a few months ago and have just been really devouring your content. Guys, she makes the most beautiful and easy to understand, informative content about your body and how it works. You've taught me so many things just via Instagram already, so I'm really excited for this conversation. And I know that there are going to be a lot of people like me that had no idea that this was a thing, and you're all going to be knocking down her door because I would guarantee that everyone probably needs a little bit of a tweak from you in some manner. So
Well, thank you so much for that compliment. That means a lot. I appreciate it. I'm glad you've learned something from my content because that's the whole point.
so much, and it's in here, but I am very excited to talk to you so you can tie it all together because it does seem like there are a certain um, bits of focus that you take with the eyes, the feet, the jaw, and your teeth that really do seem to be the way that you work about diagnosing someone. But I would love to
Yeah.
learn about you becoming an athletic trainer. You have a really extensive background yourself in being an Olympic weightlifter, guys. She is badass. And for being 116 pounds, the fact that you could yank up 185 pounds blows my mind. I know it's an insane amount of weight. So you know your body inside and out, I'm sure.
Yeah, well, thank you. Yeah, I don't do Olympic weightlifting anymore, but it was such an amazing part of my journey. And yeah, I also look back and I'm like, I don't know how I did that. You don't realize it when you're in it. You're like, this is just life. So,
Yeah. Cool.
but yeah, weightlifting definitely was a big part of my journey, and I actually really enjoy working with athletes now too. So,
Oh,
um,
cool. How did you
yeah,
come into the athletic training field?
yeah. So my background, well, I was a gymnast growing up, so I was always just very active. Just really, I came out extremely active. That's all I wanted to do was move around and move my body and learn through my own body. So as I got older, trying to figure out what I wanted to do, I wasn't really sure, but I did want to work with athletes and I wanted to work in the PT sort of rehab realm. I didn't have a lot of confidence in myself from like a learning standpoint. I didn't think I really struggled with school a lot growing up, and I've learned a lot about that now. And I think it's a really I like to be vulnerable about that because I didn't get where I am from having it come so easy to me. Actually, everything came so extremely hard for me that it's pushed me to be where I'm at right now.
Yeah.
And so I really struggled with school. I didn't think I was ever gonna be anything, and I wanted to do athletic training. Had some ups and downs with becoming an athletic trainer. So for people who don't know, I like to explain what a certified athletic trainer is because a lot of people don't know what it is and it sounds like it's similar to personal training and it's not. So a certified athletic trainer is a healthcare professional that works on the sidelines of professional sports, college sports. We work in hospital setting. We do all the rehab, the pre and post surgical interventions for an athlete. And so I really wanted to work in that setting because I wanted to work for USA Gymnastics. That was my goal. My timing wasn't so great because I just didn't, in the end, I didn't end up doing that. And it wasn't just a good time for me. And I learned a lot through working, through my rotations at school. So I went to University of Arkansas. I had an absolutely amazing experience. I got my master's there in athletic training and worked for a few teams there, but I really worked with gymnastics, and that was like my standout rotation while I was there. And it made me realize that athletes are really treated more like dollar signs versus humans. And I never wanted to do that with the people I worked with. So I ended up not working in professional sports. I still love sports and appreciate them, and I still work with athletes who come and see me. But yeah, I just didn't, that's not my story. So finished that. Also became a personal trainer. So that can get confusing for people because there is a layover, but in reality, we don't learn about strength and conditioning at all in school. So it's just very different. It's all injury rehab. So I always knew that I wanted to go into that rehab mentality and work with people that were injured.
Yeah.
And sure, there's a continuum, but the more I've learned about PRI, the more I see things very differently. So I became an Olympic weightlifter, and through Olympic weightlifting, had my own struggles and heard about PRI a few times. It kept coming up. And like you said in my intro, postural restoration is how I use and how I help people. Like how I use my athletic training certification, my master's to actually help people is not necessarily what I learned in school. What we learn in school is very traditional, more old school. A lot of regular general PTs, learn the same sort of rehab that I learned in school. And maybe lately it's getting a little bit better from what I've heard. But the way I look at postural restoration is that we're really looking at it in a more innovative way to help people heal. So started studying PRI in 2018, and I've been on this journey since. I've traveled, I've moved to learn it, and I just got certified in January. It takes a couple of years to get that, and thank you. And it's just been a journey. So that's what I do now is I do postural restoration to help people heal and feel better from whatever they come to me with.
Oh, I love that so much. What I've gathered from your Instagram is that your holistic approach seems that you're trying to help people not rid the body, but ease the body of misalignment that's causing, I guess, sensory misfiring of sensory output that's kind of throwing other things out of whack that you wouldn't really ever think are connected, but we're one meat sack. Everything is
Yeah.
in essence connected. But could you give us a bit of a breakdown of, for me, for layman's terms, what exactly postural restoration includes for you? Because
Yeah.
I've got a good gain of it now, but I would imagine most people have never heard of this. So could you give us a little
Yeah.
breakdown on that?
Most people haven't heard of it. I'm going to explain a little bit about the Institute, and then I'll explain what PRI is. So there's a founder. His name is Ron Huruska. I always want to attribute everything to the Institute because without the Institute, I wouldn't be doing what I'm doing. I did not create this information. I have my own take on the information, and that's what I use to help people. But Ron is absolutely brilliant. I've never seen anybody be able to treat the way he treats. And so he studied asymmetry, and he went to dental school and dropped out of dental school because he was so obsessed with the asymmetries. But basically, Postural Restoration is an institute based out of Lincoln, Nebraska that educates us as practitioners to understand asymmetry, neurology, a little bit of optometry, a little bit of dentistry, a little bit of podiatry. So we're really encompassing everything. They're doing some stuff with like the auditory system. We're one, like you just said, we're one meat sack. And so we have to be treated like one meat sack. We can't be looking at things so separately. And I think that's a big problem with the modern medical world in many aspects, not just from an orthopedic standpoint. But yeah, so postural restoration takes like a very integrative approach to help healing of that one person. The hard part is there's not that many of us that are studying it or know about it because it's a very small institute in Nebraska. And so it takes a long time to learn because the human body is extremely complicated. For anybody who's out there saying like it's simple, it's just not. There's a lot of components, there's a lot going on, and so we try and do our best to change how the nervous system understands, perceives the environment around us. Whether that's changing your pair of glasses, changing how your teeth hit in your mouth, giving you a different breathing technique to teach you how to sense an oblique, let's say on the left side, to help open up air in another area, compressing one place to expand another, whether it's putting something underneath one foot to feel the ground differently or changing your shoes to feel the ground differently. We are changing the input to make changes for how the body, the person, understands their entire environment. So, yeah.
Wow. Is this a newer modality that he's created? I'm guessing in the last, like, how long has this been something that's been practiced?
I think he's been thinking about this stuff since he was little, like a young kid, to be
Oh, wow.
honest, because he lived on a farm and just saw the animals were asymmetrical. And
Yes.
so for him, I think, and I asked him, I was like, Ron, how'd you come up with this? And he was like, I was born to do this. He said something like that. So I really think that he has thought about it for a long time, and it makes a lot of sense. There's a lot of connections between so many layers of asymmetry within the body and how we walk, how we stand, how we chew, how we learn how to move our bodies. But the Institute's been around for about 20 years. So it's new. It's definitely newer. But I think these connections of optometry and dentistry and, perception of spatial awareness, that's not new. The research is, they find research from the, 1907 that relates to what we're talking about here. So,
Wow.
yeah.
I was really taken with your story of kind of you sharing your journey of recognizing where your asymmetries were. And it sounds like a lot of it resulted from head injuries and different things that you had come across in your youth. Could you walk us through your personal journey and where, I guess, now that you have this information, you've been able to kind of backtrack and piece together all of the clues as to how your
Yeah.
body was in the position that it was in because of these certain things?
Sure. What's interesting about me specifically is that my biggest struggles in my own journey have actually not, like, PRI has helped me. I'm 100%. PRI has really pushed me further, but I didn't heal myself at first through PRI. My stuff was a little different, where I think it's actually good, because if I was so into my own like PRI journey, I think it makes it harder to treat patients from what I've seen. So I actually was really struggling as an Olympic weightlifter. Like you said, head injuries. I didn't realize I had any head injuries, but I had a head injury when I was 12 with loss of consciousness, and then like 2 car accidents with some whiplash. And people don't think like whiplash is anything, but it actually is. And then, I was very active. I was a snowboarder. I was a gymnast. So I've had like dings to my head, but I never really thought anything of it. And I remember my mentor asked me like a long time ago, when she did like a small assessment on me, she was like, "Have you had any head injuries?" I was like, "No." And then like a year later, I was like, "Wait a second, I lost consciousness when I was 12. Like I definitely had a head injury." So that is part of my journey. It's not something that ever like bothered me, but I did do gymnastics. I did do Olympic weightlifting very competitively. So what happens when you become a weightlifter is you're now loading a very extended pattern. And I was a very extended individual for multiple reasons. I'm 4'11", so the world is made for somebody who's like 5'8". So everything I have to do, I have to lift my rib cage up. Like if I need to reach to get something in the supermarket, I'm short. I have shorter arms, shorter stature. So that relates a lot to my body position, my posture. So that's like more of the PRI stuff. I was struggling a lot as an Olympic weightlifter towards my ending of my career. I say prematurely, but nothing's premature in life because everything happens in the right timing. But I did end or had to stop doing weightlifting right before a national competition because I wasn't sleeping. I had severe insomnia and I felt horrible. I had brain fog. I was having night sweats. I was having a lot of actual like perimenopausal symptoms, and I was 26 years old. And so I ended up diving into that, learning I had like major HPA axis dysfunction. My body was pretty much in a perimenopausal state.
Wow.
At 26 years old. And so my stuff, as much as PRI does treat that because we regulate the nervous system, I didn't directly go to PRI for all that. Although I did end up healing a lot of my stuff through PRI, but I also did a lot of work with functional medicine and, like vitamins, detoxing, a lot of this other holistic world that I don't actually do in my practice. I refer out to people. So I think there's a beauty behind that because I know what it's like to be suffering from, anxiety, depression, up and down, like issues just because your hormones are so far off.
Yeah.
And I have a lot of women that come see me, men too, that are really struggling. They're struggling with Lyme disease. They're struggling with all these issues. I had chronic Epstein-Barr virus. I
Hmm.
had all these things show up in my lab work. I had extremely low ferritin to the point where I had a ferritin of 7. It is
Whoa.
extremely, extremely low. So I did a lot of work on that
Yeah.
before ever diving into PRI stuff. But from a PRI perspective, to really answer your question, I moved to Texas, which was very healing for my nervous system. I moved during 2020, and I was in glasses. I got glasses. So I got a head injury when I was 12, and I got glasses around like 13, 14 years old. I just remember I got glasses in 8th grade.
Hmm.
So I do see that often, like head injury glasses. I see that consecutive pattern with people. And, through the years, my prescription just went up like any myopic prescription does. And then I do know that when I was a weightlifter, I had a little bit of a jump in my prescription. It had been consistent for a few years. And as I did Olympic weightlifting, my script changed. And I actually stopped sleeping around 2016 when I was weightlifting and when I was also not eating like nearly enough for how much I needed, which happens a lot with people. They don't
Hmm.
eat, they don't sleep. So I started having some insomnia in graduate school. I started doing weightlifting in graduate school. I competed in weightlifting for 3 years. I had insomnia for about 4 years. Ended up, I moved to Texas, had my eyes looked at by a neurooptometrist. I had been to a lot of different optometrists. Like my script was the same from 2016 to 2020,
Hmm.
never changed. And I remember going to see this behavioral optometrist in Texas with my mentor, and I was overcorrected by a full diopter, which ended up actually becoming like a diopter and a half later on. So when we changed that, my sleep changed within like 5 days. So that's
Wow.
something that I don't want to tell people that have insomnia that that's going to happen because that's
Hmm.
really rare. It didn't change immediately. I still had a lot of struggles, but it did change.
Yeah.
As I did different detoxes and different things, my sleep changed. So when you're sleeping more, you feel better. Your nervous system can heal, your body can heal. So, I did that. Ended up getting a dental appliance, which helped me a lot, helped my sleep, helped how I felt more grounded in my body. Started to really implement PRI. But this was also when I was taking a break from doing all the holistic other functional medicine stuff. And now I'm at the point where I don't really need to do PRI techniques. I do them here and there. I do them if I hurt, but I feel really good. And yeah, so I've healed myself. My numbers, my hormones are so much better. I've also taken time away. I stopped doing weightlifting. That was a big stressor to my life. So I think my story is just interesting in that PRI helped me. It was a piece of my journey, but I also have this other big piece component that a lot of other practitioners might not know about or might not have. Um,
Yeah.
yeah.
It sounds like it. And I feel like maybe the intricacies of PRI gave you the ability to look for intricacies in other realms
Yeah.
of healing,
Oh,
which
yeah.
seems to be the big aha moment for individual. It was for me. I've had chronic illness. I Lyme's, but no, you don't have Lyme's. Couldn't
I
find it in
know.
my blood. All that happy crap. But learning that there are so many nuances to your body and to your health, I think was what gave me at least the permission to keep seeking other, let's tie together this thing that doesn't seem like it makes sense and this thing, which is honestly what fascinated me the most about your career. I've never once heard anyone speak about the teeth and the alignment and what it
Yeah.
does for your body and uh I would love for you to talk about, it seems like the eyes, the teeth, and the feet are your
Yeah.
main points of focus. So, what does it look like when someone is coming into your office? How do you go about, I guess, diagnosing them or
Sure.
giving them a path for healing?
Yeah. So definitely agree. Eyes, teeth, and feet are a big focus, and that's because that's how the institute has trained us to look at different things. We also really focus on the respiratory system. Before I do anything with the eyes or with the teeth, or sometimes with the feet, even, I recommend a shoe. But before we do anything that could be an intervention, we spend time really teaching respiration, like proper respiration, proper what we call diaphragmatic breathing, but that has like a negative term to it now because I think that there's so many ways of teaching it, and it can get the right way, I should say, or the way that works is asymmetrical, and it's just all over the place. I just think that there's too much out there about diaphragmatic breathing, but I do focus on those things. So let's do like each piece. So let's start with the feet. Let's go ground up. So your feet are the one thing that hits the ground in the morning, and they interact with the surface on the ground. If you do not know how to move your feet properly, which means being able to properly pronate, properly supinate, it's going to affect the rest of your body. So a big problem I see is that in society today, we walk on flat surfaces. And I see people all the time wearing barefoot shoes or wearing crappy shoes. And the issue with that is that the body doesn't know how to interact well with this flat concrete wooden surface. So PRI recommends these like bulkier looking shoes that maybe don't have the widest toe box. And I get this question all the time, what about bunions? Bunions are not going to occur if you can pronate and supinate properly. They occur if you're not able to properly pronate your foot. And for what people might not know, pronation is being able to flatten the arch. Supination is being able to lift it up. It's not just about the feet, though. The feet are just a piece of the puzzle. What the feet do or don't do with the ground, it's going to affect upstairs. It's going to affect the neck. And I see people that get into a better shoe and their neck feels so much better. So the feet are really important. There's definitely resistance lately because there's so many people that are being put in these barefoot shoes. I also wore barefoot shoes for almost 3 years. I used to wear them. I remember going to London and wearing them on the concrete. I wore them in Manhattan. I trained people. I had chronic heel pain. So, I just think that you can wear the barefoot shoes, but wear them when you're hiking. We're not meant to walk on flat surfaces. We are meant to walk on uneven grounds. If you look at like cavemen or our ancestors, maybe they didn't wear shoes, which is the barefoot slogan, but they walked on uneven surfaces. They were in the jungle. They were in the desert. So that's the thing with shoes. So shoes really does matter. And I'm going to do a shout out to Lori Thompson, who creates the shoe list. And that shoe list is on PRI's, like the Haruska Clinic website. But they have a recommended shoe list. They go through shoes and they can tell you which shoes are good. And I put every single patient in a good shoe, unless, some patients are a little more complicated, but I put every patient in a good shoe, and that's a really great starting point for anybody who's listening who doesn't know where to start. So that's feet. Then we can go upstairs. Let's go to teeth, because it's like next up. We'll talk about respiration too. But teeth, for our craniums are asymmetrical because our rib cages are asymmetrical. We have all these asymmetries. The diaphragm on the right side is bigger than the diaphragm on the left side. You have 3 lobes of lung on your right side and only 2 on your left. You have a liver on your right side that's 3 pounds on average, and you have a heart that keeps your left chest wall open. So if we just talk about that for a minute, those asymmetries are going to affect everything up and down the chain, from a bony position, muscular position. Bones and muscles are going where the brain puts them. So all of this is neurology. So we get stuck in this biomechanical orthopedic mindset of, I have a left rib flare. But in reality, we have to look at what's going on from a neurological level. So when we're looking at teeth, and this is a very hard concept for dentists to understand, it's not just about what is touching or what is not touching, but let's say you have a bite that is not optimal. If you give them a dental appliance, you're giving their brain sensation of a better bite. It's like an eraser. You're erasing their norm and you're giving them something else. And so when they sleep in that at night and then they do their techniques in it, the techniques reinforce the better positions of being out of that asymmetry, understanding how to manage that asymmetry. Then those teeth, along with the exercises, it's an eraser for the brain, and it's rewiring the brain to understand a new position. And so what's amazing about that is you don't necessarily have to change the bite to create better airway, better nasal airflow, better movement in the rib cage, because you're giving the brain a different sense. Wow. So it is we're changing, and it's the same with the feet. I am changing how the feet understand the sensation of the ground for the rest of the body to follow suit. When it gets to your eyes, I mean, your visual system is your most used, most important, one of your most important systems in your body for you to understand space. So, for example, kids that walk on their toes, that's a vision problem. That is not necessarily a orthopedic problem. And so there are these kids, well, it could be a few things, right? Like, yeah, there's always a few things, but a lot of times it's a visual problem. There are these kids that are being forced to go down on their heels. It's never going to work if you don't work with the visual system. If you think of yourself like you're on a cliff, you're at the Grand Canyon, your body, and you're looking down at the Grand Canyon, what you see is going to change your body posture. So you're not going to feel as safe and comfortable in your body if you're standing at, well, most people, if you're standing at the edge of a cliff, you're probably going to show a different posture than you would standing in your own apartment eating a sandwich. So I think that the visual system, people don't always think about it, same with dental occlusion, as something that can affect how our body moves in space. I think people think the visual system affects it more, but I think that in general it's missed. So if we see people with an eye turn, or they're having some double vision or anything like that, or just in general they're not using one eye as well as the other, that is going to affect why they have chronic neck pain, why they have a shoulder that's bothering them. So you have to look at all these things. I'm not an optometrist, I'm not a dentist, I'm not a podiatrist, but I take pieces of what I've learned through the Institute and I use it to help the body feel better. And then I use my professionals when I need to. And my professionals, I'm based out of New York, so I work with people in New York. So that's kind of how it meshes together. And then we always start with teaching respiratory techniques that allow the brain to gain better sense of a lost side, which is the left side.
Wow.
Yeah.
Blown away. And I find it, I am connecting some dots for myself here. I had, I guess, what was it, fifth grade? I was knocked out on my first day of softball at bat, and you know how big a little kid softball is. It's literally like the size of your face. It broke my nose, my
It went
cheek,
into your face?
my forehead. Yeah, I shouldn't have been in softball, okay? I wasn't prepared. And I just stood there, and
It's a
it
big
whacked
head
me in
injury.
the face, a big one. I woke up with my sister over top of me screaming. No cell phones back then, so I had to wait 2 hours until the end of practice for my parents to come back. And ever since then, I always was a clumsy kid from that point on. Had a lot of weird neck pain. I do see the right side of my body. Pretty much if I go down this way, the right side of my body between really common ear clogging in this ear. I have neck pain on this side. I have a shoulder issue here. I feel rib cage tightness that feels like it's twerking this
So
way.
related.
My hip is tight. My knee sucks on this side of my ankle. And I never, ever, ever connected that it could have been from a head injury or anything in my brain not making everything else work properly. So this is very
How old
eye-opening.
were you?
Fifth grade, so I
Oh,
guess
fifth.
10, 11,
Okay.
12-ish.
Better
Little.
than
Yeah.
if you were even younger, because
Yeah.
it's a little better to have it older, but it's still a major head injury.
Yeah.
And what we see a lot of times too is I like to explain it as like some people have skin, some people have tattoos. When you have a really bad head injury, sometimes the body compensates to have extra layers of compensation. So we'll see these twists happen within the body. And that's really when it needs to go in the proper order of operations. So like if you were to just go to a dentist, let's say, and you just had an appliance made, that's might not be the right order of operations. Definitely not, because the techniques have to come first, then maybe a vision appointment, whatever you need. So I think that that's really an important concept, is that the techniques itself can be really powerful for something like that. We have these cranial techniques that are, I mean, when I use them, and some people have amazing changes. Some people have negative effects and we have to back off. and we have to go back to the basics and we have to try something else. Everyone's a little different in how their body handles what I give them, but these techniques, especially cranial cervical ones, they're neurological techniques. So they make shifts in the cranium. They make pretty wild changes for people. So I think head injuries are one thing I see a lot of, and I think people forget about these head injuries or don't think that they're as big of a deal because you were young. You forget about it.
Yeah,
They're a big
especially if
deal.
you were born in the 80s or the early 90s. You know, it's like, you're okay, wipe it off, go play. Like, you're fine.
Yeah.
And our parents didn't really, I think they were living too much of an out of body experience to be able to think about body awareness and what's happening and all of that happy stuff. But
Yeah.
it does seem like there is, there's a change coming, especially with all the longevity science that's coming out now. People
Yeah.
are kind of noticing we've done a number on ourselves, and that was also what I found so fascinating about your work. It's like you are giving people, I would imagine, in if not all, most cases, the ability to change something that's been affecting them very deeply for a long time without a surgical intervention if you
Yeah.
can avoid it, which is really
Yes.
cool. Could you talk a little bit about that and what your maybe your impetus is to keeping people out of the surgical room
Yeah.
and making it more of something that they can do daily to kind of heal?
Yeah, and I mean, I always want to avoid surgery. Once somebody is surgically altered, things change from many standpoints. Not from orthopedic surgery, eyes, jaw surgery is always the last option. And I think that there are people that just want to get surgery because they think it's a quick fix, and I think that's a mistake because ultimately it's not a quick fix, and you might have longer issues going forward.
Yeah.
And I think that if you go and get surgery, you are still an asymmetrical person underneath whatever they fix surgically. Like septoplasty, sure. You had a deviated septum, they fixed it. Your brain still doesn't understand how to manage that airflow and pressure properly. So, yeah,
Wow.
a lot of people go and get that fixed, and it makes it difficult. It makes it really difficult because underlying, you're still asymmetrical. You are not treating the root cause. If the alternative stuff, it's not really even alternative. It's extremely scientific, PRI. And if you're not looking at it step by step and you're just jumping to surgery, you're not treating the root. And so, sure, you might feel better. You tore your labrum and you're going to get it fixed. But why'd you tear that labrum in the first place? So that's why is your septum deviated in the first place? Why can you not breathe? And that's really what I think I like to challenge people with, like, well, what's going on here? You have elbow pain? Why? Why do you have elbow pain after you got braces off? There's different things that come up, and I think when you timeline it and when you really dive into someone's history, you can find it and you can mitigate the long-term damages of just going in and fixing that one area, because just because of one area might be better doesn't mean it's not going to pop up elsewhere. Sometimes surgery is completely unavoidable.
Yeah.
I get that.
Yeah.
And I
For
think
sure.
that that's why we have medicine for those cases.
Yeah.
But a lot of times, especially right now in our society, the money behind surgery is very large. I think there's a lot of amazing doctors that want to help and want to, like, I'm working right now with an orthopedic surgeon, and he wants to send me patients. That's amazing. That's amazing. He wants to send them to me so that he doesn't have to do the surgery
Yeah.
long
Wow.
term. Like, he wants to mitigate it. That's what I want to develop.
Yeah.
So, yes, sometimes people do need surgery, but it's a last ditch effort.
Yeah.
Got to
It's
try
so
everything.
it's so cool that you're at the forefront of this branch of medicine, because I really do feel like I'm 38. I feel like my generation is definitely leaning more towards looking for the root cause, which I think is, um, you know, you've always had like the inkling that like, I hear what you're saying, doc, but like something's a little off. I don't need
Yeah.
this medicine, or I'm not so ready to jump to this or
Yeah.
that. And I do love that for you, especially for your career as someone that like you're hopping all over the place and helping different offices to work with their clients and what they're doing. It is really amazing that you get to, from a business perspective, align your brand with something that is still in its infancy, but is so integrally missed
Yeah.
in terms of a lot of diagnosis. And I think just like from a business perspective, that's really cool that you're at the forefront of this and you get to kind of build your career out in the way that feels best for you.
Yeah.
What has it been like to build out your career as a hybrid between an athletic trainer and the postural restoration, and kind of picking and choosing how you want to work with people and what other offices you'd like to work with?
Yeah. It's really interesting because so I moved to Texas to learn this, and I always want to give credit to Casey Ratliff. So if she always laughs at me when I say anything, but
Shout
because
her out.
yeah, I want to shout her out. Like if you're in Texas, go see her. She's amazing.
Yeah.
But she taught me a lot, and she taught me how to work with other professionals, and she just taught me about just having a business model that works. I always loved working with people. It's in my destiny is to be working, and this is what makes me so happy. So, like, I was living in Arizona and I loved it, and I still love it there. But when it came to working with professionals near me, that I needed to, like, make that sort of a group feeling, I just didn't have it. And as much as I live in New York, and I am living in the least part of New York, like, I'm living in a beach because I just don't want to be in New York. I do not like New York, but I am here because of the professionals that I work with. And so I've been working with some of these providers for about a year now, and it's life-changing to actually work with people that respect what you do and are interested in what you do, want to do case studies, want to present, want to do things with you.
Wow.
So Funk Physio is the location that I'm working out of in New York. They are a PRI center. Yohei Takada, also an amazing mentor, amazing colleague of mine, and I am in the same clinic with people that are like-minded in what we're studying and what we want to do. And they have everything PRI related. They have, the rib cage models, the pelvis models, everything I need. And also they have the same goal to help these patients. Mm-hmm. So we actually are starting to do maybe case studies, just like study groups every other month with providers around us. We actually brought in Ron Haraska to come in and talk to us in May. So we're really starting to, I really want to create a New York City team that I feel all these providers are like top notch and are really helping that patient. And if we're confused, we will go and have other people to reach out to. I'm really working on that. That it takes time. It takes a long time. So I've been working with a dentist and one dentist and two optometrists but I work with SUNY Optometry, which is a really well-known optometry school in New York City. I actually work with the chief of vision rehab there. And so that's been really cool. So it's just been an amazing experience to work there. It's also a teaching hospital, which makes it a different experience than just working with an optometrist with their just a regular private office, which I have done in the past. I've worked with two other optometrists prior, but the connection I have with the people at SUNY is very different than connections I've had with other optometrists. They will do what I say. I'm working with students. Students are interested. They're like, what are you guys doing? And then the dentist I work with is a regular conventional dentist who she somehow got into this. She's so funny. She cracks me up. But she she does what I need her to do. She's interested, skeptical, but interested. And it's been really just great to have these providers. My patients really like them, and I've seen some great changes. We're doing standing dental adjustments. We did yesterday a guy who's like over 6 foot. I'm 4'11". The dentist I work with is like probably like 5'3". I don't know. Anyone above 5 foot, 5'1", I have no idea what height they are. But the optometrists I work with are both also like, I think she's like 5'3". And so we have these stools. We were just joking about it yesterday. Like, we're with this 6 foot guy. My dentist has to go up on a stool to do the adjustment because we're doing it standing. We do the refractions standing. And that is something that is really not being done in many places around the country. It takes a long time to have providers do it. It is for optometry, it's very difficult because you typically get refracted when you're sitting in a chair with your head coming forward. That's typical. It's convenient. So being able to do things and look at things differently and have an open mind, those are the types of providers I'm working with. I just linked up with an orthodontist. He's in Jersey, and we're going to start to share some patients together, 2 patients. I'm very excited for that. He's extremely open-minded. Orthodontia is probably, I don't know enough about it. There's so much I need to learn to be able to help the people that come see me. And so he wants to teach me his ways, and I want to show him a little bit about what I know about asymmetry and anatomy, and we can work together to benefit that patient, which is what I'm doing with optometry and what I'm doing with the dental appliances right now. So I think that developing that team for me is what's keeping me in this state.
Yeah. Yeah.
So it's been it's been really great. I'm very grateful for the providers I work with. I am excited to go to work when I know I have a day at the dentist or a day at optometry. Really. And then going into Funk Physio every day. I'm so excited. I would be very bored if I was just working by myself, I think.
I was going to say it's so I was very surprised that you were an entrepreneur in this model, and it is kind of really neat that you've been able to build it out in a way that allows you to have this fluctuation of cases and who you're working with and what you're doing, just so it's not staying stagnant, which is a really cool perk of being an entrepreneur. But I just love that it's also giving you the ability to just continually learn. I'm sure every single patient is something you've seen before, but not quite, because everyone's different.
Yeah.
So it is really cool that you're just constantly, seems like, learning every minute of the day on something new, making a tweak to what you knew, or adding something new, like, okay, let's remember this for next time. That's really cool.
Yeah, actually, I'm working also with like a holistic therapist. And so that's been really cool. So she teaches me a lot too, because a lot of this stuff, a lot of pain is rooted in emotional issues.
Yeah.
And a lot of it. And so I think that I try and send her people, and so we try and share people, our patients, because this holistic aspect of treating the pain through breathing versus also going to some talk therapy and then reinforcing it with different models of therapy. There's just so many different, I am learning a lot. I do love learning. I think there's so much to learn, and it just makes me happy to be learning. So I love being able to converse with people that are also on that level where they're just trying to elevate their life. And those are the people I'm surrounding myself with.
Oh, so cool. And especially for the medical field, it does get a really bad rap of people being very stuck in their ego and what they learned 30 years ago, and
Yeah.
not allowing for growth that also kind of limits not only their clients but their business. And
100%.
it's really cool that you're at the forefront of this, and you're going to be able to create this community of other healers that are very much in tune with the fact that we don't know everything yet, and we maybe never will.
Yeah.
But this amount of learning, just from my perspective, just a regular person that has a body and I feel pain, and I practice jujitsu. That helped me a lot with learning body awareness. Before, I feel like I would have been like, where's my elbow? Where's my ankle? Like, I don't know. I can't feel it. And I think a lot of people walk through life without body awareness, which would probably lead you to not think that one thing is connected to the other. So I just love that this
True.
is becoming a thing,
Yeah.
Like it's just, it seems like the forefront of a really big branch of medicine that could help millions of people.
Yeah, I really think that I agree with everything you said. It's very powerful. Postural restoration is very powerful, and I think sometimes people go see a provider and maybe don't have a great experience, and so they're like, this isn't for me. But in reality, it takes a really long time to get to the level of being a provider where you've had all these other courses. So you got to be patient with these providers, and it just takes a long time. It's a new science, and we're still. It's not new science as in all the research has been there for years. It's just being put together now. So we have to, it takes time for us as providers to be able to help you. And that's another thing I always tell my patients is if I can't figure it out, I will find somebody who can. So I really if people are coming to me and I'm stumped, which happens, I'm human. I am not able to help every single person. I wish I was. I always every day I wish I was 100 times better at my job. Um, and if I'm stumped, I will call other providers. That's why I have the team. And if I don't know after we go through the team, we will continue to figure it out with other methods. I will call someone to come in. There's always resources, and so I think that I just hope people are open-minded to try providers. If you didn't have a great time with one, try another one. Try it again. So,
Yeah.
yeah.
I would love to hear your advice for someone. I see it, it's a frequent comment on your page. I don't have a PRI near me.
I
What do
know.
I do? Who do I go to? How do I help myself? Have you been able to come up with, I guess, a routine of sorts or something that they can do at home to maybe try to help mitigate or at least open their mind to what is truly kind of the root cause? Is there anything that you can recommend for people that can't get to you?
It's really tough because I am one person. There's only 200 certified providers in America. There's a few people in Europe that are doing it. Europe, it's growing. It's growing. They're my friends out there. I send them people all the time. People are flying out in Europe to other providers to learn from that, or to, get treated and learn. I am working on something. I'm in the process. I can't tell too much information, but I'm working on something for people, especially people not in America that do not have access. It's going to be some time before it's released because I'm not when I do something, I put all my energy into it, and I really have a lot of work to do, but I'm working on something. So
Yeah,
that's what I
stay
have to
tuned,
say about
everybody.
that.
Stay tuned.
Yeah. So
There'll be all the links in the show notes for people to come to your website to book
awesome.
with you if they want to. But definitely, guys, pay attention to her Instagram. If you are on a healing journey, or you are at least aware that like the chiropractor isn't cutting it, you don't want to like go down the road of cortisone shots and all these things. There are other
Other
methods
routes.
available. So many things to do, but you will at least glean a lot from her Instagram, enough to be like, okay, I'm not crazy. I'm on the right path. 200, that's a lot of practitioners. There's somebody somewhere for you. But I would love to know just one quick tip you could give with the breath work.
Yeah.
Because breath work, I think I never really thought about it outside of like literally dying via cardio and like lacrosse in high school or trying to go for a run. But during the pandemic, a lot was talked about the lungs and breathing properly, and learning that babies are learning to inappropriately breathe through their diaphragm because they watch their parents and don't see their stomach coming up and down. And it does seem like something that can be corrected. Could you just give us some tips
Yeah.
and tricks about how to realign our breath?
Sure. I would say the best tip I could give, especially to parents with kids, if your kid is struggling with anxiety or anything, or you feel like they're not breathing properly, give them a balloon and make them fully blow up the balloon until they have no air left, and then pause. And honestly, for adults, it's also really beneficial to do.
Yeah.
Um, I my tip would be to sit on a step, like a low step, and just blow up a balloon. If you learn how to fully exhale, that will make a big difference in your life. So fully being able to exhale when you're consciously thinking about it will transfer into your day when you're subconscious. So that's,
that.
yeah.
Very easy. Everyone can do that.
I love
Everyone.
balloons, and kazoos are also really great for kids, or bubbles, things like that.
Yeah.
Super,
I
super great.
I really loved, I think that was the first piece of content that I came across from you, was someone lying down on a table. You had them blowing a kazoo while moving their hip. And I was like, I'm sorry, what's happening here? Are they like having a panic attack and she wants them to be happy and like blow this kazoo? Like, what's going on? How does that,
Yeah.
how does the hip movement specifically, if you can recall what video I'm talking about, you're moving the leg while a woman is laying down. You're telling her to breathe in her diaphragm, feel her muscles. What is that?
I don't remember that specific one, but
No?
we
Okay.
use a kazoo
You
for
have
a
a
lot of
few.
reasons.
Yeah.
Yeah, you could throw a kazoo into a lot of the PRI techniques. The ones I like do it with like two or three, but a lot of times I'll do it if I feel like somebody doesn't have a lot of vocal sound production, well sound production, or if they have a tinnitus complaint, I use a kazoo. If they have any ear clogging complaints, I use a kazoo because it helps to vibrate the cranium a little bit and it helps to get that flow back in the cranium. Yeah. So I'll use it for many reasons. Also, it really helps with kids because they don't have as much attention span. So if you give them a kazoo, they like it, and it really makes them, they hear it. You hear your own resonance, and so that makes a really big difference in, again, that sound production and just being able to fully exhale all the air out. It's not really an exhale with a kazoo though, but it is.
Yeah.
It's a noise. So that vibration makes a big change. Vibration is also sense.
Wow.
Yeah.
Is there anything I haven't covered because I am a novice in this that you think
You
is
did
really
great.
important for someone to know or hear
You did
regarding
so
their health
great.
and
I
PRA? Oh,
I
thank
really
you.
thought your questions were amazing. So
Oh my God, thank you.
yeah,
I,
and
I
I've
just
done
wanted to do it
podcasts,
justice.
so
Oh, I know. She has a podcast as well, guys. I will link that in
it's a
the show notes.
little.
You have to listen. It will catch you up very quickly on what you can be doing for yourself.
It's been slow because I'm working on something else. So that's why the podcast has been slow. No, I think that those are the advice and tips I can give out. I think if you are located in the US and you can't find a provider, Postural Restoration has a find a provider like page.
Cool.
And so I think those are only certified providers. There's a lot of people that aren't certified that are around the country that are doing some amazing things. So what I would say is reach out to PRI and say, hey, I'm looking for a provider in whatever, Wyoming. Do you know anybody? They don't have to be certified. See what PRI can give you if you're struggling to find somebody.
Cool. I'll absolutely put them in the show notes as well.
Yeah.
And if anyone would like to work with you, the best for them to do is visit your link that is also in your link tree if you head
Yep.
to her Instagram account, but I will also put that in the show notes. I will be making an appointment. We'll try for the fall when I can free up my schedule, but I absolutely know now that this whole right side of my body's connected and there's something I can do about
Or
it to help,
disconnected.
or probably disconnected, more likely than that. And I would love to have you back whenever you're able to share more about what you're working on.
Sure. Yeah, that sounds great.
So my last question for all of my guests is, how do you make your life rich?
Ooh. For me, because I'm right now, I've been traveling all over, but because I'm in the city a lot, I need to travel. And so traveling for me is a reset to my entire nervous system. And I'm not just talking about like travel. I need to travel and I need to hike. I need to be in nature. And I've realized the last 2 years of my life, like being in nature is extremely grounding for me. I have to do it. So that's how I make my life rich. For me, life is not about how much money you make or anything like that. It's just about how happy you are and how much you're feeding your soul.
Oh, so well said. I love that so much. Aleena, thank you so much for sharing all of your expertise and opening everyone's eyes to something they probably haven't heard about before, but I'm sure they need it in some regard. And I hope that they will book with you, although you are one person, but you just have such a passion for this. And I know I would feel very safe in your care for helping me to navigate my body and figure out how to make it talk to itself again.
Thank you so much. And I
This was
appreciate the
so
compliment.
fun.
This
Thank
was.
you. Pleasure. Okie dokie. We're done.